This is the skills exam for the health assessment class, and this is my patient Jake. He's going to be doing the exam with me today. My name is Caitlin. I'm going to be your nurse today, and basically I just need to do a full head-to-toe assessment. Are you okay with that?
Mm-hmm.
Okay. If you could go ahead and tell me your height and weight.
5'11", 210 pounds.
Okay, I'm just going to make some notes while we're going along for accuracy. And basically, my patient looks well-groomed. He doesn't have any hearing deficits. His speech is clear and understandable, and he is pleasant and cooperative with the exam. All right. So just overall, his skin is pink. It's dry, warm. Nail beds are pink. Skin is elastic. And capillary refill is less than 3 seconds. Next, I'm going to just feel around your head. Do you have any pain right now?
Mm-hmm.
Okay. So the cranium feels smooth, no masses. I'm palpating the sinuses. Any tenderness?
No.
Okay, good. His hair distribution is equal and thick. If you could raise your eyebrows for me and wrinkle your forehead. Good. So cranial nerve number 7 is intact. And I'm just going to feel around your neck area for any enlarged lymph nodes.
All right.
Any pain?
No.
Okay, good. Okay, have you been having any eye pain or any eye discharge lately?
No.
Okay, I'm just going to look inside your eyes. So the eyeball is white, glossy, and moist. The conjunctival sacs are pink. Pupils are equal, round. Okay, now we're just going to test your vision. If you could cover one of your eyes with your hand, and I'm going to cover the opposite of mine, and you're going to see my hand from the outside. I want you to tell me when you see it in your peripheral vision with your head still straight.
No.
Good. How about?
No.
Okay, and let's do the other eye.
No. No.
Okay, perfect. Okay, I want you to stare straight at me, like stare straight at my nose, and cover one of your eyes. Okay, just keep it covered for a few seconds. I'm just checking the alignment of your eyes. Okay, now I want you to keep staring straight at me. Don't move your eyes, and uncover. Okay. So his eyes are aligned. All right, now I'm going to test your cranial nerves of your eyes. So if you could move your eyeballs, just move them up and down for me. And then look in towards your nose and out. Good. So cranial nerves 3, 4, and 6 are intact. Okay, now your ears. I'm looking at the structure of his ears, and they are symmetrical, no abnormalities. I'm going to test your hearing with one of the cranial nerves, number 8. Do you hear anything?
Yes.
What does it sound like?
I'm rubbing your fingers together.
Okay. How about with this side?
Same thing.
And are they equal, or is one of them louder than the other?
They're both equal.
Okay, good. Cranial nerve 8 is intact. His hearing is equal. Okay, have you had any issues with your nose, any drainage, any trouble breathing?
No.
Okay, so I'm just looking at the structure of his nose. It appears to be normal and midline with his face. The septum is midline. And it is patent. Could you just take a deep breath through your nose for me? Okay. All right, if you could just open your mouth for me, and I just want to take a look at your teeth and your gums. And pull your lip back for me. Okay, so his gums are pink and moist. Okay, that's good. His teeth are white, they're straight, free of any decay or debris. And stick your tongue out for me. Okay, so the tongue is smooth, it's pink. If you could lift your tongue up to the roof of your mouth. The ventral side of his tongue is smooth, pink, glossy, and shows veins, which is normal. And do you have any problems with your tonsils? Do you still have your tonsils?
They've been taken out.
Okay, let me just say ah for me.
Ah.
Okay, so absence of tonsils. And if you could move your tongue, stick it out, and then move it from side to side. Okay. And then open your mouth for me. Say ah one more time.
Ah.
Okay, so the uvula is midline, so cranial nerve number 10 is intact. Okay, now we're going to assess your neck. Okay, so the trachea is midline, no abnormalities, there's no masses. I'm just assessing the lymph nodes again in the neck area. Which I do not palpate any enlarged lymph nodes. I did not feel any pulsations either. Okay, so I just need to assess the range of motion of your neck. If you could turn your neck both sides for me. And up and down. And do you have any pain with that?
No.
Okay. He has full range of motion of his neck muscles. And I'm going to put my hand on your neck. I want you to turn against resistance. Like, I'm going to push on your face just a little bit. There you go. And this way. Okay. So his muscle strength is good. And now I'm just going to listen to his carotid pulses and assess for any bruise. Parotid pulses are 2+, very audible, no bruise. Okay, so his chest seems even and symmetrical from just inspecting it. What I want you to do is stand up for me and turn around if you could. Okay. And I want you to take a deep breath in and out. One more. Okay, so chest expansion upon inspiration and expiration is even and symmetrical on both sides. Now we're going to do the tactile fremitus. Basically, I'm going to put my hand on your back and I want you to say 99 a couple of times.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Okay, and upon palpitation of his back, I do not feel any crepitus, no masses. Okay, now I'm going to listen to your lung sounds. Whenever I move my stethoscope, if you could just take some deep breaths in and out, okay?
All right.
Okay, lung sounds are clear in all fields, no adventitious breath sounds. Okay, if I could have you turn back around and just have a seat again. I'm going to take a listen to your heart. You can just breathe normal for this. Apical pulse is 74. Now I'm going to go back through the 5 heart sound spaces and listen with the bell for any extra sounds or any murmurs. Okay, so I do not hear any extra sounds or any murmurs. S1 and S2 are clearly audible with the diaphragm. Okay, so the breast exam is deferred for this exam. Now we're going to skip to your arms and your legs. We're going to do an assessment of those. So if you could just hold your arms out for me. Okay. So just basic inspection and palpation of the arms. They seem symmetrical and even. Thank you. Okay, so now we're just going to test muscle strength and range of motion. So if you could move your arms, we're going to test the shoulders first. So if you could move your arms above your head and then bring them back behind you. Okay, and then out to the side. Okay, so we are testing the range of motion of the shoulder, and he has full range of motion, no pain?
No pain.
Okay, so full range of motion and strong muscle strength. Next, we're going to test your elbow. If you could bend them, and now just extend them out. Okay, so full muscle strength and range of motion on the elbow joint. Next, if you could bend your wrist, we're going to go in and out. And now we're going to rotate them. And any pain?
No.
Okay. Full range of motion on the wrist. And open and close them. And each of your fingers. Okay. Good. Okay, so shrug your shoulders for me. Okay, and now you can relax. Now I'm going to put pressure on them. I want you to shrug against it. Okay, so cranial nerve number 11 is intact. And now I want you to, I'm going to hold my arms out. I want you to try to press them down. Okay, now I want you to pull them up. Okay. So we are testing his biceps and triceps, which he has full range of motion and full strength. Okay, your hand strength, muscle strength, I want you to squeeze my hand. Okay, with the other one. Good. And I'm just going to palpate your pulses. Radial pulses are +2 bilaterally. Okay, now if I could just have you lay back, however you want to. If you want to lay this way, I just need to take a listen to your stomach. Okay, so the general appearance and contour of his stomach is flat. I don't see any masses or visual pulsations at this point. I'm going to listen to his stomach. Okay, so I hear vowel sounds in all 4 quadrants. Now I'm just going to feel around your stomach, okay?
Okay.
Any tenderness? Any pain?
Yeah.
Okay, so palpitation of the stomach, it is soft and non-tender. No masses were percussed. And at this point in the exam, I would assess the femoral pulse and the inguinal nodes, but we are going to defer those for this exam. Okay, if I could just have you sit back up for me. And now we're going to test the muscle strength and the joint range of motion for your legs. So his legs, just looking at them, they are equal, normal, symmetrical. Skin is intact. It is warm. No edema. Okay, and do you have any pain whenever you move your joints?
No.
Okay. There is a moderate amount of hair on the lower extremities that is equally distributed. The popliteal pulse is +2 bilaterally. I'm just checking your pulses and your feet right now. The dorsalis pedis and the posterior tibial pulses, both are +2 bilaterally. Okay, so if I can have you stand right here, we're going to test the range of motion for your hips. So basically, I need you to, let's move this back again. Okay, so I need you to just keep your leg out straight in front of you. Okay, and then you're going to need to do it behind you as well and off to the side. But make sure that you can see it here. Okay? And if you could do the same with the other leg. And do you have any pain doing any of that?
No.
Okay. All right. Okay, so now we're going to test the range of motion for your knees. If you could bend your knees up, put them out, and then bring them back behind you. And any pain with any of that?
No.
Okay, so full range of motion with the knee and hip joint. Okay, now you can go ahead and I want you to, we're going to test the strength of your upper leg muscle. You could just go like this and hold it for a few seconds. And the same with the other one. Okay, and now I want you to test the strength of your lower leg muscles. If you could stand on your tippy toes for me. Okay, and then just do it a couple of times. Good. Okay, so he has full range of motion with his lower extremity joints, and muscle strength is good. Okay, now you can go ahead and have a seat for me. We're just going to test the range of motion with your ankles and your toes. Okay, so for your ankles, just bend them up and back. Here you go. And now we're going to rotate them. Any pain?
Yeah.
Okay. And this one? Up, back, and we'll rotate them. Any pain with that one?
Yep.
Okay. So for your toes, I want you to just bend them for me. And any pain with that?
Yeah.
Okay. So he has full range of motion of his ankle and toe joints. Okay, now I want you to lay back one more time for me. We're going to test the Babinski reflex at this point. Okay, you're just going to feel me touch the bottom of your foot, okay? So basically, we just want to stroke along the lateral portion and then across the ball. Okay, so now if you could stand up for me again. We're going to assess your spine. Okay, so just looking at his spine, he has good posture. He's upright, erect, shoulders are back. He looks symmetrical and just standing here straight. Okay, now just kind of turn this way, and I need you to bend over for me. Let's see if your spine is aligned. And it is. It is midline and it is aligned. Okay? And I don't feel any masses or abnormalities. Okay, so you're able to bend forward. Now I need you to bend side to side. We're testing the range of motion of your spine. Do you have any pain with that?
A little bit on this side.
Okay, so he would have full range of motion when he goes to the left side, and 4 out of 5 range of motion upon bending to the right side. Okay, now I just need to assess your coordination. So if you could take a couple steps just from here to the wall and back, I just want to assess your gait function. Okay, so his gait is steady. Now I want you to, okay, you're going to just take a couple of steps, but the way I want you to do it is put your heels to your toes, just like that, and take a few steps like that. Perfect, okay. Now we're going to do something to test your coordination called the Romberg test. And basically, you're going to stand with your feet together, arms at your side, and close your eyes. Now, you're going to have your eyes closed for 20 seconds. And basically, we're testing to see if you are steady and can hold this position for 20 seconds and then open your eyes back up. So you can go ahead and open your eyes. Okay? Now what I want you to do is use your finger. You can face me. Okay, so I want you to touch my index finger with your index finger, and then I want you to immediately touch your nose and just follow it. You can move your head. Just now touch my finger again. Now touch your nose. Again. And touch your nose. Good. Okay, so that was the finger-to-finger test. Now this one is called the finger-to-nose test. It's also called the drunk test. It tests your coordination. I want you to close your eyes and hold your hand out to the side, just somewhere away from you. It can be wherever, just one of your fingers. And now I want you, with your eyes closed, to touch your nose. Good. Okay, go ahead and lay back for me again. Okay, what I want you to do, this is called the shin to heel test. And I want you to take this foot, the heel of this foot, and I want you to rub it down your shin in a straight line. Okay. So he has a normal function on the shin test. Okay, now I'm going to test your sensation. And I need you to close your eyes for me. All right. So I'm going to, if you can give me your hand, I'm going to place an object in your hand, and I want you to identify what it is. You can feel around and tell me what you think this is.
Cotton ball.
Okay, good. Now, I want you to keep your eyes closed, and I'm going to draw an imaginary figure. It's going to be a number on your hand, and I want you to be able to tell me what number I'm drawing, okay?
Seven.
7, yes, good. Okay, so keep your eyes closed. I'm going to test the sensation of your legs and your feet. If you could just tell me what you think you're feeling, or if you're feeling anything at all.
I feel like you're coming down my chin.
What's that?
I feel like you're drawing down my chin with a pencil.
With a pencil, yes. And how about
On the inside, on my right leg, the pencil.
okay? And did they feel equal?
Yes.
Okay. And
That was a pencil on the bottom of my left foot. Pencil on the bottom of the right.
okay, good. Now we're going to test the sensation in the upper extremities. So if you could just hand me your hands. And just tell me what you feel or what it feels like.
Just feels like a light touch on the top of my hand.
Okay? And your right hand?
The same, the light touch on the top of it.
And are they equal?
Yes.
Okay. Now we're going to test for sensation on the face. I'm going to just touch your face with something. I want you to tell me what you feel.
Feels like a cotton ball.
Yes, it is a cotton ball. Okay, you can go ahead and sit up for me. Okay, so this concludes the skills exam for the health assessment course. And thank you for your participation.